Good morning. This is me, Nafisa, and today we'll be learning about type 1 hypersensitivity reactions. Allergy is also called as hypersensitivity. Hyper means more, sensitive means response. So, hypersensitivity means response in a higher way or exaggerated response. So, allergy is body's exaggerated response to any harmless substance. There are four types of hypersensitivity reactions. Today we'll be learning about type 1 hypersensitivity reactions only. All of us at some point of time have suffered from one of these: redness of eyes, itching of eyes, watering of eyes, sneezing, running nose, nasal congestion, redness or itching of skin. These are the examples of type 1 hypersensitivity reactions. In order to understand what happens in an allergic individual, first, let's understand what happens in a normal individual. Our body's police, that is white blood cells, will identify any harmful substance or foreign substance entering our body. This foreign substance or harmful substance entering the body is called as antigen. Examples of antigens are substances, usually proteins on the surface of viruses, fungi, protozoa, bacteria, or non-living substances such as bacterial toxins, chemicals, drugs can also be antigens. When antigen enters the body, then WBCs in our body tries to protect us from these antigens by producing antibodies. Antibodies is also called as immunoglobulins. The type of antibodies produced is IgM, which is one of the first antibodies produced to fight infection. Later IgG takes over. These antibodies produced can neutralize or destroy the foreign substances or harmful pathogens or antigens that has entered the body. And hence we are protected, or can I say that we are healthy, that is, we do not suffer from diseases or infections. Does allergy happen to everyone? No. Allergy does not happen when a person's body identifies what is a harmful substance and what is a harmless substance. But an allergic individual's immune system cannot recognize harmful or harmless substances. Harmless substances to which allergic individual produces antibodies are referred to as allergens. An allergen is an antigen, but not all antigens are allergens. Most common examples of allergens are house dust mites, animal dander, moles. These cause year-round allergy or what is known as perennial allergy. Grass, pollens cause seasonal allergy. Medications or drugs like NSAIDs or some antibiotics cause drug allergy. Certain foods like groundnuts, eggs, fish, brinjal cause food allergy. Others, example insect bites, perfumes, chalk powder, etc. When allergen or the harmless substance, example chalk powder, is inhaled, since an allergic individual cannot recognize harmful or harmless substances, so to these harmless substances also their body secretes excess antibodies. Antibodies secreted in an allergic individual are of IgE class, therefore called as IgE mediated diseases or atopy or type 1 hypersensitivity reaction. Most allergic reactions are IgE mediated and therefore most allergies are type 1 hypersensitivity reactions. Some of these IgE antibodies will neutralize the allergen. And as excess IgE antibodies are produced, so the other IgE antibodies will bind on the surface of mast cells or on the surface of basophils. Thus, mast cells and basophils are sensitized to the allergen. This is called as sensitization stage. Sensitization stage does not cause any symptoms. Basophil is a type of WBC present in blood. Mast cell is a type of WBC that are present in tissues throughout the body, predominantly in eyes, nose, skin, and bronchi. When this allergic individual, after some days or some weeks or some months, is exposed to the same allergen for the second time, allergen will cross-link with the IgE on the surfaces of mast cell, signaling the mast cell, or I can say it as activating the mast cell to degranulate. Degranulate means releases inflammatory mediators which are also called as inflammatory chemicals. That is, degranulation of mast cells takes place. Degranulation of mast cells takes place, which releases many preformed inflammatory mediators. Inflammatory mediator most commonly seen in allergic individual is histamine. Histamine has to bind to histamine receptor to show its effects. Histamine receptors present in brain are H3. Also, H1 receptors are present in brain. Histamine receptors present in eyes, nose, skin and bronchi are called as H1 receptors. Histamine receptors present in the stomach lining are called as H2 receptors. When histamine binds to histamine receptors present in brain, leads to vomiting. When histamine binds to H1 receptors present in eyes, leads to redness of eyes, itching of eyes, watering of eyes. This condition is called as allergic conjunctivitis. When histamine binds to H1 receptors present on the nose, leads to sneezing, redness of nose, itching in nose and rhinorrhea, that is runny nose. This condition is called as allergic rhinitis. When histamine binds to H1 receptors on skin, leads to raised elevation on the skin called as urticaria or wheal. Example, when an ant or a mosquito bites you, there is a slight raised elevation on the skin. This is called as urticaria or wheal. This condition is called as allergic dermatitis. When histamine binds to H1 receptors of the bronchi, causes the smooth muscles of the bronchi to contract. This is called as bronchoconstriction, which means the airways gets smaller, which results in difficulty to breathe. This condition is called as allergic asthma. Histamine binds to H2 receptors present in the stomach lining. This is responsible for regulating the levels of gastric acid production in the stomach. And as we all know, HCl, that is the gastric acid, is required for digestion and is therefore doing a good job. As we are learning about allergy, so we will learn only about histamine binding to H1 receptors present in eyes, nose, skin and bronchi. Revising, in an allergic individual on second exposure or subsequent exposure to the same allergen, degranulation of mast cell takes place and mast cell releases many preformed chemical mediators. Mediators means help, as these chemical substances help in inflammation. Therefore, these chemical mediators are also called as inflammatory mediators. Many preformed inflammatory mediators are released, but the most important preformed inflammatory mediator is histamine. This histamine on its own cannot show action. That is, histamine has to bind to histamine receptor to show its effects. Histamine receptors present in eyes, nose, skin and bronchi are called as H1 receptors. If histamine binds to H1 receptors in eyes, symptoms are redness of eyes, itching of eyes and watering of eyes. Indication is allergic conjunctivitis. If histamine binds to H1 receptors in nose, symptoms are sneezing, redness of nose, itching in nose and rhinorrhea, that is runny nose. Indication is allergic rhinitis. Rhino in medicine means nose. Rhea means excessive discharge. So rhinorrhea is watering from the nose or runny nose. Rhinitis is again made up of two words, rhino plus itis. Itis means inflammation. Rhino means nose. So rhinitis means inflammation of the nose. If histamine binds to H1 receptors in skin, symptoms are little swelling or raised portion on the skin and indication is known as allergic dermatitis. If histamine binds to H1 receptors in bronchi, symptoms are difficulty in breathing and indication is allergic asthma. These symptoms occur in seconds to minutes of second exposure to allergen. Therefore, this process is called as early phase of allergic reaction. This is also known as an immediate hypersensitivity reaction. We need to remember the most important preformed inflammatory mediator released because of mast cell degranulation is histamine. And this histamine is responsible for the symptoms of early phase. The other effects of histamine are: histamine will act on the blood vessels and leads to the dilation of the blood vessels. That is, the blood vessels' diameter will increase and hence more blood flow to the affected tissues, which results in redness. Also, because more blood is flowing, so this will result in increase in temperature, therefore warmth in the affected area. We all know that blood is known to maintain the temperature of our body. So increased blood flow results in warmth. Histamine also causes increased permeability of the blood vessel walls, and hence plasma comes out of the blood vessels into the tissues, resulting in swelling, also known as edema. Also, because of capillary permeability, the inflammatory cells will leave the blood vessels and enter the tissues. Histamine also acts on nerve endings, which leads to itching and pain. Histamine also results in smooth muscle contraction, which results in pain. Histamine causes mucus secretion. Histamine also acts as a chemoattractant for eosinophils and activates eosinophils. Late phase of allergic reaction occurs about 4 to 6 hours on second exposure or subsequent exposure to allergen and involves newly synthesized inflammatory mediators. These new mediators are generated by breakdown of mast cells. The membrane of the mast cell is made up of phospholipids, and because of the breakdown of mast cells, the enzyme phospholipase A2 is activated, and phospholipase A2 converts phospholipids to arachidonic acid, and from arachidonic acid, numerous leukotrienes and prostaglandins are produced. How are they produced? Arachidonic acid is converted to prostaglandins by COX enzymes, and arachidonic acid is converted to leukotrienes by lipoxygenase enzyme, which uses FLAP. PAF, also known as platelet activating factor, is also a newly synthesized inflammatory mediator released by mast cells. Mast cell degranulation releases preformed inflammatory mediators. Amongst the preformed mediators, histamine is the most important. Also, cytokines and chemokines are inflammatory mediators, which are released from the mast cells. Newly synthesized inflammatory mediators are prostaglandins, leukotrienes, and platelet activating factor. The most prominent amongst the newly formed inflammatory mediators is leukotriene, which is 100 to 10,000 times more potent bronchoconstrictor than histamine. Although the biological activity is similar to histamine, but leukotrienes amplifies the action of histamine. Inflammatory mediators released because of mast cell degranulation causes redness and warmth, itching, pain, swelling or edema. Inflammatory mediators causes these effects, that is redness, warmth, pain, swelling. These are the signs of inflammation. All these inflammatory mediators are responsible for inflammation. Other effects of these inflammatory mediators are increased bronchoconstriction and mucus hypersecretion. Histamine, prostaglandins and leukotrienes also causes increased permeability of blood vessel walls. Hence, plasma comes out of the blood vessels into the tissues, resulting in swelling, also known as edema. This explains why swelling increases over a period of time. Degranulation of mast cells also releases newly synthesized inflammatory mediators like prostaglandins, leukotrienes, and PAF. Leukotrienes is most important. Why is leukotriene most important? Because leukotriene is 100 to 10,000 times more potent bronchoconstrictor than histamine. Therefore, leukotriene will amplify the action of histamine. Inflammatory mediators causes these effects of redness, warmth, pain, swelling. These are the signs of inflammation. All these inflammatory mediators are responsible for inflammation. Other effects of these inflammatory mediators are increased bronchoconstriction and mucus hypersecretion. This occurs after 4 to 6 hours of second exposure to the same allergen and is called as late phase of allergic reaction. Late phase symptoms can be more severe than symptoms in the early phase. When histamine binds to H1 receptors present on the eyes, this leads to early phase symptoms which occurs within seconds to minutes. These symptoms are redness of eyes, itching of eyes, and watering of eyes. The late phase symptoms are which occurs after 4 to 6 hours of second exposure of the allergen is more redness and swelling. This allergic condition of the eye is known as allergic conjunctivitis. When histamine binds to H1 receptors present on the nose, the early phase symptoms which occurs within seconds to minutes is sneezing, redness of nose, itching in the nose and watering of the nose, that is rhinorrhea. Late phase symptoms that occurs 4 to 6 hours is nasal congestion. Allergic condition of the nose is known as allergic rhinitis. When histamine binds to H1 receptors on the skin, leads to slightly raised elevation on the skin known as urticaria or wheal. These are the early phase symptoms which occurs within seconds to minutes. And after some time there is diffused redness or erythema or flare. These are the late phase symptoms which occurs after 4 to 6 hours of second exposure of the allergen. This allergic condition of the skin is known as allergic dermatitis. Histamine binds to H1 receptors on the bronchi, leads to bronchoconstriction, which is an early phase symptom, and congestion of bronchial mucosa, which is a late phase symptom. This allergic condition of the bronchi is called as allergic asthma. An allergic individual may have one or more of these allergic conditions, as one is related to another. For example, when we have runny nose, we may also have redness of eyes or watering of eyes and difficulty in breathing. Late phase symptoms are because of inflammatory mediators like prostaglandins, leukotrienes, and PAF. Leukotriene is, however, the most important inflammatory mediator responsible for allergic rhinitis and allergic asthma. When leukotriene binds to leukotriene receptors, leads to late phase symptoms of allergic rhinitis and allergic asthma. Allergic inflammation of the inner lining of the nose is referred to as allergic rhinitis. Early phase symptoms of allergic rhinitis are sneezing, redness of nose, itching in the nose, and watering of the nose, that is rhinorrhea. Late phase symptoms of allergic rhinitis are nasal congestion. Episodic rhinorrhea, sneezing, obstruction of the nasal passages with itching of the conjunctiva, nasal mucosa, and oropharynx, that is itching in the throat. These are the hallmarks of allergic rhinitis. Chronic allergic rhinitis may be associated with sinusitis and otitis media. Symptoms generally appear before the fourth decade of life and tend to diminish gradually with aging, although complete spontaneous remissions are uncommon. Also, because of capillary permeability, this allows the inflammatory cells to leave the blood vessels and enter the tissues, resulting in more inflammatory cells in the affected part. Histamine also acts as a chemoattractant for eosinophils and activates eosinophils. Histamine, prostaglandins, leukotrienes, and platelet activating factors all are responsible for attracting eosinophils, hence accumulation of eosinophils takes place. Moreover, cytokines and chemokines released by mast cells also attracts eosinophils. Eosinophils are the predominant cells in allergic conditions and asthma. Increased numbers of eosinophils in the tissues is a hallmark or characteristic feature of allergic diseases. This explains why blood levels of eosinophils are commonly elevated in people with asthma and in other allergic diseases. That means allergy should be resolved after 4 to 6 hours. But why is it that allergy symptoms are continued for days together? As mentioned before, inflammatory mediators also results in increased vascular permeability. Hence, inflammatory cells like neutrophils, basophils, eosinophils leave the blood vessel and enter the site of allergen. These inflammatory cells will release inflammatory mediators and hence more inflammatory cells. Moreover, each of these inflammatory mediator is a chemoattractant for eosinophils, so more inflammatory cells in the affected area. Eosinophils is a type of WBC that releases toxic substances that damages the invading cell and nearby host cells. That is, damages the epithelial cells. So when the cells are damaged, more inflammatory mediators are released. If more inflammatory mediators are released, so more inflammatory cells will come to that place and hence results in more inflammation. This results in cascade of allergic reaction which leads to continuous symptoms, at times even in the absence of the allergen.